Welcome, and greetings. This is the Birmingham Civil Rights Institute and our Mindful Mondays. I am Charles Woods, the Birmingham Civil Rights Institute education director and trainer. I'm sorry. And today we're going to have an encore presentation of a program we did last year about food deserts. Food deserts is something that contributes to a lot of the health issues that Black people have and other people of color in a lot of urban areas and rural areas as well. And so we're going to have an encore production of one of those presentations that we did last year. And then, if you want to stay connected to us and celebrate Black History Month all year round, stay connected to the other programs we did this month through our Facebook and our YouTube pages. As well, any program that we do here at the Birmingham Civil Rights Institute, we have a disclaimer that says that um, the opinions expressed as part of the Birmingham Civil Rights Institute presentations are solely those of our panelists and do not express the views or opinions of their affiliates. And so we just want to welcome you today, the last day of February, Black History Month, and say thank you for tuning in with us all this month and continue to stay connected with us. If you want to volunteer with the Birmingham Civil Rights Institute, please go to www.bcri.org and fill out a volunteer form so that you can come and support us in another way. So thank you once again and enjoy the program.
All right. Good day, everybody. And it is a pleasure to be here. I want to thank Dr. Gilmore and the wonderful staff at the Birmingham Civil Rights Institute for the opportunity today to present to you a description of food deserts in Birmingham. So today I want to introduce our esteemed panel. We have Gino and we have Dr. Johnson joining us today. And today they're going to share their expertise on food deserts and the health outcomes associated with those food deserts. Okay. So I want to start with you, Gino, and I want you just to give a brief introduction of yourself and tell the world a little bit about who you are and what you do.
Well, thank you so much, Dr. Lonnie. I first want to thank Ms. Gina and all of the staff at the Birmingham Civil Rights Institute, as well as Ms. Gilmore here at the city and Office of Social Justice, and everybody, Josh Coleman, for this opportunity to come here and share my expertise with you guys on this such a vast topic that's definitely plaguing our community at this time. I am a graduate of the University of Montevallo, where I majored in kinesiology and my minor was in health promotion. I was a student athletic trainer there, as well as I played soccer. I also played as the wonderful fraternity of Kappa Alpha Psi, where our mission is achievement in every field of human endeavor. So that brought me to back to training and helping people. My mission is to help people and continue to, push health and wellness in our community, in the Black community. I was able to matriculate from the University of Montevallo, where I went to serve as a fitness instructor / personal trainer in Mountain Brook, Alabama. I did that for 7 years. I then went to Chicago, where I served as a level 2 strength coach in Chicago in what's called Lincoln Park, a very affluent area in Chicago. I was also able to serve as a strength coach in a not so affluent area of Chicago to kind of give back to the Chicago area people that might couldn't afford my services in the higher end area. So I learned a lot about food deserts and disparities and differences in Chicago and being a native from Birmingham. I then came back to Birmingham, where I now am currently in the role of wellness coordinator, employee wellness coordinator here at the city of Birmingham. But I came back as a fitness instructor. So I trained all the first responders, fire, police, and everyday employees of the city for 2 years. And then I matriculated into the role of wellness coordinator for the city employees.
All right, terrific. That is, man, you come very well experienced, and man, you bring a wealth of talent to our city, brother. So I definitely appreciate it. All right, Dr. Johnson.
Dr. Lonnie, thank you guys for having me. I am Dr. Cree Johnson. I am a board certified family medicine physician, and I help everyday working people learn how to live healthy, happy, whole lives. And I myself am from a food desert. I'm from Perry County, Marion, Alabama. And I was born and raised there, and I matriculated at Spelman College, the best school for sending women to excel. And I went to the medical school in Kansas City, did my residency here in Birmingham at St. Vincent's East. So I'm happy to be here. I take care of patients from diaper to diaper and everything in between. So a lot of my patients live in food deserts, something that I'm very well versed in. So I'd just like to say thank you guys for having me, and I look forward to the conversation.
All right, so let's get started. So I want to ask both of you, what is like your definition of food desert? So just so that the audience will have a strong foundation.
Well, I guess the technical definition is 500 or more people, or 33% of the census. Everybody knows what that census is. They came around, people thought they was getting scammed. The folks, how many folks live in your house? Who live here with you? How much you make? So the census that tracks those numbers, so we can have grocery stores and other sustainable food things. When you don't participate in those kind of studies, or that's kind of what hurts us. But 500 or more people with at least 33% track population must reside more than 1 mile away from a supermarket or a large grocery store. So that virtually means if you don't have a Whole Foods, a Publix, a Winn-Dixie, a Food Giant, a real life grocery store within a 10 miles or a mile of your house, then you live in a food desert. No matter how many fast food restaurants are there, no matter how many Subways. We think Subway is another great, but it's fast food. So 1 to 10 miles, if there's no superstore or grocery center within that radius, then you, my friend, are in a food desert.
Okay.
I just like to add that if you are in a rural area, like I said, we may have some people that are listening. That is the 10 miles there. And like you said, a half a mile to a mile, you're in an urban area. So just think that's a lot of people, depending on where you live. So you have to be mindful that just because you live in the big city doesn't mean that your city or your town is equipped with all of the big things of the big city. So be mindful of that.
Right. Okay. And that's very informative. So what are the effects of living in a food desert that residents experience? Specifically when we begin to think about health disparities.
Doc, I'm gonna let you take that one.
Okay, cool. Thank you. I think the biggest one that comes to mind for me is diabetes. We live in the sugar capital of the world. Everything is sweet tea. Everything is French fries. Everything is fried, dyed, and smothered. Whatever. So when we think about that, if we're running to fast food restaurants all of the time, if we're running to the Dollar Generals because they have the little grocery section in there, and that's what's closest to you, then we're at risk for having diabetes, pre-diabetes, diabetes, strokes, and heart attacks, and heart disease, which is already a number one killer for Americans. Have to be mindful that if we're eating in the fast way and the quick way, which is not necessarily the healthy way, then we're at risk for dying early. We're at risk for being sicker early. We're at risk for being on a lot of different medications in a state that Medicaid hadn't even been expanded in. So we're just already having an 8-ball in so many ways. And then once you add it, we're in a food desert. Now we can't get access to the right kind of foods. So that means insulin. That means diabetic medicines. That means having to prick your finger more times in a day. So diabetes is the biggest one that comes to mind. And if you live in a food desert, you are 2 to 3 times more likely to have diabetes.
That's very interesting. So what are some of the solutions to this? Let's talk a little bit. I think we understand some of the problems. And I do want to talk about a little bit about about why this problem is so sticky. All right, but what can we do as individuals, and what can our elected leaders do to help mitigate this problem?
Gino, you want to take it?
Yes, ma'am, I can do that. Well, what we can do is hold ourselves accountable first. And I know that's hard. Nobody ever wants to point the finger at themselves and at their family. And I am guilty of, I have 3 small kids, 5, 3, and 1. I have definitely been guilty of when I'm having to pick the kids up and by myself while my wife is working late. I'm guilty of stopping by the fast food restaurant and getting them French fries and whatever they want. And sometimes, prior planning prevents a poor performance. All right. I like to give my clients that train with me and our first responders that have worked with me before that little analogy. It's called 5 P's. Prior planning prevents poor performance. And when I say prior planning, when we're talking about food deserts and nutrition, we're talking about food prep. So, that if you might be a single parent or a parent that's working 2 jobs and kids have to eat, it's easy to go and buy the little things or give them money on their Cash App card for them to run down the Dollar General to eat, the processed food, or I dare not call it food, but the processed stuff that you're able to get out of a Dollar General, versus, hey, I'm on Sunday night, let me cook this, let me bake, or however you want to prepare these chicken breasts, let me cook some asparagus, let me cook some, and having the access to those foods. Now, I do understand the food desert, that's what we're talking about. But if it takes you, 20 minutes to drive to a supermarket on Sunday, we suggest doing that, getting those healthy foods, and then preparing those healthy foods for the week. And then, when you have a meal prep, now there's not much of an excuse for you to say, hey, I didn't have the time, I had to stop by that fast food restaurant. So prior planning prevents poor performance. On top of when it comes to our legislators doing things to get more money into our areas to get more food, they got to hear from us. We put these legislators in office. We support these people when they come out and they say, hey, I got this and that, and I got this and that, and I'm going to do this and this for you. And oftentimes we're not focusing on the big things that change our communities, i.e. a food desert. We're more worried about what kind of entertainment district is coming, or what kind of, where the next stadium is going to be, or this. But it's up to us as a people to hold our legislators accountable and say, hey, man, we don't have sustainable food. My little girl is growing up on Dollar General and Popeyes and McDonald's, and she's on a crash course to see Dr. Cree Johnson for early onset diabetes. That's the kind of society that we're living in. And me dealing with employees for the city of Birmingham, over 70% of our employee population lives below the poverty line. That's the city of Birmingham, which is like Dr. Cree said, the city, the big city. She's from Perry County. I'm very familiar with MMI, by the way, Mary Military.
Okay.
But the big city of Birmingham, who has, the population size is astronomical, Black city, run by Black parishioners, we are 70% under the poverty line. So that means 70% of our people are living in a food desert, and they make less than minimum wage, or right at minimum wage, which you know what that is, $7 and some change. So we have to be the driving force behind that.
Can I add, Dr. Lunny? I think that what would be helpful is that I know that a lot of resources may be posted in the local health departments. I think that maybe getting the whatever resources that are out there, getting it out there to local physicians, so that we can know, if I had signs up in my office to say, guys, I know we're in a pandemic. Hey, you can get your food stamps. I mean, even if you didn't get food stamps before, you may have the ability to get food stamps now. We don't have that information. So I think starting where you can educating the physicians, the ones that are on the front line, are seeing the patients, day in and day out, you trust your doctor, and you trust your lawyer. Okay. So if I came in and I say, hey, Miss Smith, man, you really losing weight. What's going on? You would be surprised during this pandemic how many elderly people are continuing to lose weight. I'm like, have you heard of Meals on Wheels? Or have you heard of all of these resources? And a lot of them have not. So I think that getting the information outside of the health departments and into the local physician's office may also be a way of getting, boots on the ground and more grassroots effort to getting whatever resources that are out there to the people.
All right, that's a terrific. This is a terrific discussion, and I am learning so much. So the approximately 149,000 people in the city of Birmingham live in what we call a food desert, a census designated food desert. So what are some of the long-term outcomes that you feel will affect residents? Like, what are some of the long-term effects that residents are going to experience because of this?
Doc, can I take that one again?
Yeah, sure. Yeah. Go ahead, brother.
Both docs. So I'm seeing, like I said, I serve in the role of employee wellness coordinator, and here, in the city, we have employees that do live in that food desert, and what we know is it definitely affects your bottom line. It affects our insurance rates, as we oftentimes, part of my job is to encourage a primary care physician relationship. Oftentimes, due to educational deficiencies and access, we don't understand that having that relationship with the primary care physician kind of helps you guide your health along the lines of becoming out of these things, these disparities that continue to plague our community. When you don't have that relationship, the first time you get sick to where you can't really shake it off, the first place you go is the emergency room. And so what that emergency room does is it's going to charge you, and it's going to ding our insurance as a city. So as a whole, now we have to come back and we have to account that in and say, man, we got 70, we got this many employees living under the poverty line, making minimum wage, but they're taking ambulance rides and they're going to the emergency room, which is hitting them from 500 to 750 to 350 to whatever the case may be. And the insurance has to cover that. So then we have to turn around and apply the insurance back to take it out of their check. And so they like, man, why am I getting dinged? Why is my insurance so much? Well, when you got a family of 4 or 5 on a $35,000 a year budget, not to mention the elderly, Big Mama might be living there, Paw might be living there,
Correct.
And there's one income in this house, and that one income may be let's just say, for instance, $37,000, decent income. But can you feed 5 grown people off $37,000? Not gonna happen. It's
right.
hard.
I definitely want to talk a little bit about the supply demand issue in just a second, but I want to ask both of you. Let's take it back a little bit. I remember like growing up, like McDonald's literally was a treat. That was a treat. That was something more like what you did when you got your report card. All right.
Mm-hmm.
So
yeah.
What happened in our society to where the processed foods, some of the fast food restaurants, what happened in our society to where that became the go-to versus food preparation in the home?
I think that as the generation gap gets smaller, like you got younger grandparents these days. Like our grandparents, made sure that we had, Sunday meals. And if my mom had to work, she would just take us down there. She was cooking every single day, and then for us, we had to go to Selma, which was a ride, 20 minutes to get to the next McDonald's. So you were just going to Selma just to go. You had to have reason to go. So for us, I think that, and then my grandmother set the stage for my mom, who set the stage for me. So, I'm gonna cook. I'm young, I'm a young mama and wife. I'm not cooking every day, but I'm gonna get you enough 4 meals a week that we're gonna eat in the house, or whatever. So I think that a lot of it, because the generation gap has gotten so smaller, maybe a grandmama at 35. And you may not have, I think that comes with, teaching and education and just being able to pass things down from generation to generation. So therefore, my kid asks for McDonald's, even though it's one close. I'm like, no, we're gonna go home and get this grilled cheese sandwich, maybe just as bad as a McDonald's, but it's at home and it's made with love, kind of thing. So I think that a lot of it is, I mean, seriously, that generation divide is getting closer and closer. And we put ourselves at risk for more, more ER visits, like he said, more urgent care visits, and just a sicker population because we don't know what's in all of that food. I mean, for the longest we had a field, we grew our fruits and our vegetables, so we knew that was good stuff. So now in this day and age, we don't know what we're getting, which means we're living shorter lives, which means we're getting cancer sooner and often, which is a cycle that we continue to get into that we can't really get out of the rat race.
Okay, very interesting.
I'd like to piggyback on that too, Doc, if I could real quick. We also live in a microwave society, which is we want it now. We want to be able whatever we want.
Everything.
We want that. We want to put it in the microwave, ding, 30 seconds. We want it hot and ready, like Little Caesars pizza. And unfortunately, that is what has plagued our community because we're so busy doing this with school, doing this. What this pandemic has showed us is slow down. All right, slow down. Think about, plan out, do the things you need to do. Take care of yourself because health is the real wealth. And, like I said, that microwave society is really, with all the money and everything is on the internet now. And so all these things are now attainable. And it's programming us to say, man, I want to live like that. I want to go and get to this money as fast as I can. So I want to skip all these steps. It's kind of like I hated algebra and long division and all that stuff. But it taught you discipline by not skipping steps. And when you don't skip steps, then you understand the value of the work that you're putting in. So you're going to get a better product. So I like this analogy. I like to tell my professional athletes. One of my professional athletes actually helped me realize this. He gave me an analogy because I was a rah-rah guy kind of in his face. He said, hey, I don't need all that. He said, I don't need all that. He said, it takes more work to plant the garden than it does to maintain the garden. And that hit me. I said, you're right. So basically what he was saying was you don't have to come in rah-rah and we don't have to start all over. The garden, I done already planted the garden. You just got to kind of get me back right. So it's going to take a little bit more effort, which is a little bit more efficiency. It takes more effort to be efficient, but it takes more work to plant the garden than it does to maintain the garden.
Right, absolutely. I like that metaphor. So I got a question that I want you all to wrap your brains around. So from a market perspective, like you talked a lot, Gino, a second ago about the finances of a food desert. So from a market standpoint, right? Businesses will go where they feel like they can make money. Okay. Mm-hmm. So how do you deal with food deserts from that perspective? So when you sit down and you have conversations with Publix, they may say, hey, well, we got this community outreach thing, but really at the end of the day, Publix is going to go where they feel like they can make money. Like Birmingham is a high poverty city. All right. How do you reconcile that? How do you get high quality grocery stores to come to a high poverty city when these grocery stores are going to be interested in their bottom line?
There's got to be federal subsidies. It's as simple as that. There has to be this food desert deal is getting bigger and bigger by the year, by the minute, by the month. And so, the lawmakers, the legislators, the congressmen, the senators, and the parishioners, meaning us, the citizens, we have to make a stand and we have to say, hey, we can't eat. Our kids can't concentrate in school because they're eating a high sugar, high processed food diet that's not developing their brain. They're not getting the education on what is a well-balanced meal. They don't understand what a good breakfast is. They don't understand macro and micronutrients. They don't understand protein to carbohydrate ratio. So, education has to come to that, but how to get a big time like a Whole Foods or a Publix and stuff, it has to be some federal help, because we have to guarantee that those people that these grocery stores get paid. And so what's going to happen is with the federal hand, that means that's grants that's going to go not only to the grocery store and incentives for them to build, but that's also grants and things that go into the community. My man Jalen Sims on Facebook just said community gardens. Like, you got to utilize things like community gardens to teach the people, to help educate the people on growing, getting our own food, what's going to do what. And then in a best case scenario, I think you could do a co-op. You get a community garden, you bring a Publix in with some financial what's the word I'm looking for, Doc? Some financial incentives. Right. Now you leverage that community garden and you grow some of the food, you sell some of that food out there. And if it's a citizen that is growing or working at the community garden, growing that, then they're able to reap some of the benefits financially off of their food they're putting in there. We talk about farmers. I mean, Alabama is the home of agriculture. We started agriculture.
Exactly.
You know what I'm saying? Like, it's plenty of fields and plenty of places to grow food out here, and it's plenty of people that are growing food. It's it's a huge Black Farmers Association that grows food, that provides food to all these things. So we need those are our real life heroes. We got to tap in. Those legislators got to tap in with that Black farmer group, the Black Farmer Co-op. Get those guys in there. Get these community gardens up and going. Because, like I said, we got to do it ourselves. We can't have people from over the mountain that's gonna come and do it for us. And that's kind of where we've been stuck at a look sometimes. So, getting that help, getting those subsidies from the federal aid and federal government, whether it be on a state or federal level, getting those incentives into those grocery stores, as well as getting the incentives into the community so that the people can afford the grocery store. So it's got to be, it's a lot of checks and balances there. We want you to be able to run a business. I mean, we're in a capitalistic society, so those businesses are not gonna come if money's not there. But money is there, and it's grant money there, and we got to fight for it. We got to go get it.
Right, Dr. Johnson.
Yes, I also think that when I think about this, I think from a standpoint of starting to educate our children early that this is an option, that farming is an option. When I think of farmers, I think about my great granddad was a farmer, my granddad was a farmer, so I feel like that was an old person's job, but I'm getting older too, so now that's not necessarily, they weren't that much older. So I think that going back to the days where we had home ec and we learned how to cook and we did all these things, that could be something that someone ties in with the school system to say, let's do community gardens here. Let's start early, knowing that this is something that you can do, that it should do. It's a popular thing that we're going to be doing, a good thing to do. And I think starting young, saying this is something that you can do it as an option, you never know what they'll open up as well. So I would say, yes, get the information to people already in the community. But if we're not educating the kids that's coming behind us, it's going to be, they think the food's supposed to fall out of the air. We have to do the education, and so that we teach them that, hey, gardening is pretty good. My grandmother used to say, if you don't help to plant it and you don't have to pick it, you can't help to eat it. So once we start doing those kind of things and bringing that forward, I think that will help as well.
Right. So the key to bridging the gap between high quality grocery stores or high quality food production. So I'm hearing three things. I'm hearing that we're going to need government subsidies to help bridge the gap. Okay, a high poverty community, right? So there's going to be a finance gap there. All right. And then I'm also hearing from Dr. Johnson, education, like that generation gap. The generation gap leads to an information gap. All right, and we know that knowledge is power. Right. So when that knowledge is not passed down, that accumulated information that we've gathered over the generations, when that's not passed down, then it creates a deficit. All right. And so, but what's really interesting and very hopeful is that we also are hearing this concept of do for self. All right. So I saw where Jalen Sims, the brother, was like, hey, grow your own food, right? So, the the Booker T. Washington and so many leaders in our community, that's what they champion. They champion self-determination. They champion do for self, grow your own food. Like, what happened to that? Why
Education. Education.
Right. Yeah.
what specifically about education?
So the lack of that type of education, you know. So when my dad is a baby boomer. He's 77 years old this year. He'll be 78 this year. So I come from, you know, that's a 40-year age difference between myself and my dad, which I'm very thankful of, honestly, because he taught me a lot about work ethic and, you know, doing the right thing, building character, you know, all those things that you would think other people are teaching their kids, which is not always so. But to get into the education again, you know, as Dr. just said, you know, home ec, technology, all those different trades that have been taken out of school, they've been replaced with a few new trades now. I know you got nursing, which is out at Huffman High School. You got a couple of different trades, but that home economics and those things like that are not in our curriculum anymore. They've been taken away. They've been taken away from the curriculum. They've been exonerated from the curriculum. And that.
Well, I just want to ask one follow-up before we pivot. So let me ask you, is dependence on the government, is that antithetical to do for self?
That's a great question.
That's a good question. I don't think so. Oh, go ahead.
No, you got it up.
Go ahead. I don't think so. I think that we have to take whatever means we need to get to the next step. And if that's what it means, getting the help to be able to fund get the seeds and the soil and all of that kind of stuff, I don't think that's antithetical. I think that it's appropriate and it's important. If we're going to get to the next step, we're going to need that help, and to do it on a scale where it's impactful. I think that you do need the help.
Okay. All right. So I want to pivot a little bit and talk a little bit about the dollar stores. So there isn't a dollar store desert in our communities, as you all know. They're like, I live in the East Lake Roebuck area, and let me tell you, we got plenty of dollar stores. Okay. Yeah. So are they helpful or hurtful?
I think that's a catch-22. It's a slippery slope, as people like to say, because, you know, for things that you need to get, they can be helpful. Yeah. You know, but when we think of the dollar store, me growing up, I grew up on the west side of town in Fairfield. Western Hills Mall was like the mall. You know what I'm saying? Like, that was the thing when I was growing up, and it was a treat to go to Dollar Tree. And, you know, you could go to Dollar Tree with, you know, $3 and come up out of there racking. But I never in my life went to Dollar Tree, and not to say that I don't want to be condescending or anything like that, but I never even fathomed going to Dollar Tree to eat my meals.
Right.
I never had to wonder, like, oh, okay, yeah, we're going to Dollar Tree. I got to go to Dollar Tree to get this pizza. I got to go to Dollar Tree to get these pizza bites. I got to go to Dollar Tree to get, like, we went to Dollar Tree to get candy and paper planes and slingshots and, you know, different little novelty things that cost $1, $2, $3, whatever. But we never went to Dollar Tree to have to sustain our way of living, which is food. And so I think that, so in that case, it's definitely a major caveat to plague in our communities, because they do have access to cheap food that, yeah, it's gonna fill your stomach, but what is it doing to your body? And, you know, I'll let Dr. Johnson really get into the breakdown of what those processed things do to your gut flora, how it blocks absorption, and how then, you know, your body just pretty much starves out, because you can't, even when you do eat right, you know, then in the area of cleanses, I mean, so much we can get into, but the area of cleanses, everybody want to do a detox. They want to do a cleanse. They want to do this, but you're wiping out all the good stuff that you need when you do all those, when you do multiple of those things. So to say, so you and make it so bad, you can get all that stuff at Dollar Tree now. At Dollar Tree. Exactly. You can get you a cleanse, a pizza, and all those novelty things all at the same spot. Ain't that something? That's got so systems put in place make things work. The system was put in place to have our community in the area that we're in now. So a system, so to go back onto that, what you asked, Dr. Lonnie, a system has to be in place with government funding to help us get up out of this.
I agree. I agree. I think that I agree because I have a Dollar General that's closer to me than my Piggly Wiggly, and where I live. So I'm like, I can run to Dollar Store and get those batteries that I got, on Christmas Eve, because they open late. I mean, they open to 10 o'clock, much later than the grocery store. But I've never gone there to say, well, man, I need to go and decide what we're gonna have for dinner. That's our closest spot. But like I said, that's a generational thing, and we have to plan. Like Gino said, if you're not planning and you're not planning to go to the gas station so you can go that extra set of miles to get the groceries that you need, then that's what you're gonna end up doing, is getting the pizza or getting the just whatever it is, the ramen noodles or whatever, that kind of thing. Yes, it's those quick fixes, and it is so detrimental to our health. Stomach cancer is huge. Colon cancer is so big now. So many younger people are dying from colon cancer. And I think a lot of it is what we're putting into our temples. We're just eating whatever we can get because sadly, everybody's on a budget. We're in a whole pandemic, where people are really pinching their pennies. Unemployment has run out, and on and on and on. So a lot of people may be using it as an option when they didn't even think of it as an option before the last 12 months, because that's what they have and that's what they can afford. So we have to go back to educating and saying there are systems out there, there's staff, there's all of this kind of stuff, because people don't know. And we're in a great digital side, and that's a whole nother conversation that we can have, because if we're putting it on the internet, does not necessarily mean that our people are hearing it. You know what I'm saying? So we're in a cycle. Like I said, we're in that rat race.
Right. And that's the beauty of panels like this. I mean, it gives experts like you all an opportunity to distribute high quality information to the residents. So, Dr. Johnson, I want to ask you. So, my people are from Uniontown, Alabama, which is in Perry County too. And I remember there was this Piggly Wiggly down there, and that Piggly Wiggly is closed.
It's closed. It's closed now.
It is. It is closed, right? So can you just compare and contrast rural food deserts with those here in the city? Like, what are some of the similarities that you see?
I think that it's a whole different vibe, the whole rural food deserts. My dad has a church in Uniontown, Dr. Lonnie, so we go to Uniontown a lot. But I think that in our mind, we think nothing of it. It's our way of life. Sadly, you don't think that it's nothing to drive 30 minutes to go to the grocery store. My parents still live in Marion. When they come up to visit, they say, we're going to go by Walmart in Bessemer on our way home, or we're going to go by Walmart in Brent on our way home. And all of we think nothing of it. That is what we've done. I'm almost 40. That's what we've done my entire life. And it just becomes a way of life and a way of them having to pivot and to make do when they're in the city. They see all the doctors in the city. They don't do anything down there but live and work and have community. But anything that's a substance, they come to the big city, which is an hour and a half away. So the idea that you're in a food desert, because when I thought about this talk, I said, oh man, I mean, Marion is a food desert, but I never had thought about it before preparing for this talk, because that was our way of life. So when you're in a very rural area, it looks different because you're used to going out of your way to get the things that you need. But sadly, that's the way of life. Very, very sadly.
Right. So I always talk to my students about cycles of disadvantage and cycles of advantage, right? So you in one or the other. You're either in a cycle of disadvantage or you're in a cycle of advantage, right? And so some people call them virtuous cycles or vicious circles, right? So if you are poor, I just saw the graphic, and if you're poor, you're going to pay more for your healthy groceries, right? And so the very thing that people in the city don't have, which is financial resources, is going to cost them more to actually access healthy lifestyle practices in the way of food. So how do we, how can we use education to break cycles of disadvantage?
I think that cycles of disadvantage are huge. So like I said, I'm 2 generations ago, I know about farming and I'm somebody's doctor. I mean, I was in the fields and having to learn about okra and corn and that stuff itches, if you didn't know. But so I'm only 2 generations removed from that. But my grandparents made sure that my mom went to school, and by way of her going to school, it made sure that education was important to us. So is that so now we get thrown out of somewhat of a cycle of disadvantage because they weren't educated. So now we're able to be educated. And my mom didn't play about that. You're going to school, you're going to finish in 4 years because I'm only paying for 4 years. So we had these things that we were, our guide was different than their guide was. So I think that I'm at a good place because I know what it was like. So I don't want to have to go. I don't want myself to have to be in the fields. Now, if that's your ministry, you do your ministry and you do it well. But it wasn't mine. But I had the ability to learn that. I had the ability to pick the corn and the okra and shuck the peas. And now when I sit in the boardrooms, I can know that where I've come from and where I'm going because I've had the ability to see what disadvantage and advantage can be. So I jumped out of that one circle and I'm jumping into the other, and hopefully that I can continue to progress with that for my own children and the legacy.
Right. So the residents, like there are a lot of, like we already talked, there's a lot of poverty in the city of Birmingham. The residents who are receiving SNAP benefits, how would you, and there is a new online program for these benefits. How would you, Dr. Johnson, help these residents engage in healthy lifestyle practices in terms of their food selection?
I think that one thing is seeing a doctor. If they get into the doctor, you get your weight checked every time you go to the doctor. You're gonna leave there 9 times out of 10. The doctor's gonna tell you what kind of diet you need a ADA diet. That's the American Diabetic Association diet. You need fruits and vegetables, and we got these little plates that I pass out to my patients that look just like that. To say, here, put your food on plates like this, so that you will know. A lot of that is education, but we have and Gino could probably talk more about this, but we got a great digital divide. Yes, it's on the internet, but how many people can access that? I mean, in my town, they are, that's huge. In our town, they're driving buses with Wi-Fi on there, so the children can just do school. So it's like, oh, it's great that it's online, but do people have access to that in this time? So Gino, you take it away. I've been talking a lot. Go ahead.
No. You're doing great. I am just surfing along right with you. I mean, you're hitting all the high points. I promise. But to talk about that, like I always want to bring it back to my employees. So we have about 3,700 employees here at the city of Birmingham. About 12 to 1,400 of those are first responders, and we have everything from a laborer all the way up to a high level executive. So our labor force, the lower end of our labor force, very rarely has access to computers and digital workshops. So when we send things out, emails and different things like that, they don't get these emails because they don't check them. They don't have a computer at home. Some of them live in rural areas, and some of them don't want to be a part of the new digital reform. They say, I'll just take it. So we have a service called Everbridge, which is a text message service where we can get in contact with all of our employees all the way. So, we try to do health and wellness reminders in that, in the text message realm, because some of them, honestly, they still operate on the flip phones or the one touch, smartphones. And so if you have a non-smartphone, then, you're kind of disconnected from you're missing out. And but if you've never been a part of that, then I guess you're not necessarily missing out in your mind. But where it comes to financial readiness, I think that plays a big role in this, is teaching our people how to manage their finances. We got people, robbing Peter, chase Paul to pay Paul, and we got people chasing their tail. They think they're working these 2, 3, and 4 jobs. That's, they think that it's keeping them sustainable, but they're not even they're not putting into contemplation how much time it's taking them to get from this job to this job, how much gas it's taking them, how much they're away from their family, how much they're not able to get back and sit down and talk to the people that they need to be guiding on the right and the wrong things to do. How much time that their children or whoever is in the household is spending on the internet doing and watching things that they probably shouldn't be watching, programming that's detrimental to the direction that we're trying to move. So financial reform is a big part of this education. I want to make sure that we hit on that. And so what we do here at the city is we have a partnership with Operation Hope inside Birmingham, which is a federal grant funded financial wellness opportunity. And so what they do is come in and they do tax preparation, they do financial reform, they do financial counseling, they do the whole nine for our employees for free. And that's at the city of Birmingham. But I feel like every high school, when I came up in high school, we had an economics class. My economics teacher was unbelievable. He was great, Mr. Ziegler. Rest in heaven, Mr. Ziegler. He was a great teacher. He took us, not only did he teach us, the ins and outs of just economics baseline, but he also took us on field trips, on economic field trips, and showed us the inner workings and how economics impacted everybody that from the top all the way down, from these big businesses to small businesses. And so that made us have an understanding on how finances can, either help push you forward or drag you down into the mud. And so, I definitely want to partner those two. Financial education and education have to go hand in hand. And oftentimes in our Black community, we are not getting financial education. We're getting they're spoon feeding us the education part, but they have completely removed financial education from the equation. That has to be added back in.
Wow, man, that's very insightful. So let's think a little bit about as we come to the end of the program. Let's think a little bit about the pandemic. I know that you all mentioned earlier that the pandemic has had an impact. So can you discuss just a little bit what impact, what effect has the pandemic had on food deserts and healthy lifestyle practices in our community in Birmingham?
I think that the pandemic has been detrimental to us, our mental health and our physical health. And I have watched people gain so much weight over the last 3-4 months, and they're like, we can't get out. We're afraid to go walk. We're afraid to exercise. We're afraid. We're just eating and nibbling and enjoying ourselves. I'm like, we're a year into this. It's time, So I would encourage everyone to check the benefits. WIC is out there if you need it, and the SNAP program is there. So people check that for women, infants, and children. People are still having babies. People are still making babies, and the WIC program is still there. So make sure to contact your local health department for more information on these. Oh, there's a number right there: 1-800-942-4673 for more information. And you may be eligible for SNAP and didn't realize it. So I think that just go if you're like, man, I need a little extra. My unemployment benefits ran out. Call that number and see if you meet the requirements or the forget them and go forward. Don't be ashamed. We don't know how long this thing is gonna go along. We're at least another 6 months to a year in it. Don't let pride keep you from getting help. Get the help.
And there are several other piggybacking off you, Dr. Johnson, SNAP. If you, a lot of kids go to school and they depend on that free lunch. They depend on these programs to eat. My dad was in education. He taught at Huffman High School as an ROTC instructor for about 25 years. And I can't tell you the countless times that he's helped students that couldn't eat, didn't eat. And, that one meal that they got at school, or maybe 2 meals, because the free lunch, breakfast and lunch, was the only meals that they were eating for days. So just imagine on a Friday, they might not eat. They might eat one time, maybe 2 times over the whole weekend. And so they're starving when they come back to school on their Monday. That's the only way they can eat. So they do have these programs during the pandemic. They still have these programs at certain areas. Several of our rec centers still deliver the free lunch. I know Joel Simmons over at Fountain Heights Community Rec Center. They still have a free lunch program that kind of helps to provide for that Druid Hill, Fountain Heights area. So I encourage everybody to do their due diligence and get on to your social media. And if you're not the tech savvy person, then there's numbers you can call. There's you can contact your local your local neighborhood presidents. They will have this information. Birmingham Civil Rights Institute will for sure have some information, and I'm sure be willing and happy to guide you to where you need to go. So there you have to get out, like Dr. Johnson said. Don't let pride get in the way of your health, because health is wealth. Don't let it drag you down. There are several programs out here giving food and assistance away. They're giving it away, and people are just not only not know about it, but some they may not come forward. So hey, if you want to save your life, you want to impact your life, got to get out there and open your mouth and get that help. And then it's up to us. Sometimes we might know somebody, an elderly person, or a struggling single mom, and she may be a little too prideful, but we can get out there and open our mouths and get that assistance to her or them. So
right, yes. So are there any questions from the audience? I know that we were going to take audience questions. All right, so let's while we wait on that. So I know earlier we talked a little bit about the Dr. Johnson, you talked about the absence of Medicaid expansion in Alabama. So why do you think the government is reluctant to invest in healthy lifestyle practices and in health in general? And do you think the government is reluctant?
Correct. Gino was that's not where the money resides.
You already know what it is. That's exactly it.
That's not where the money resides, So oddly enough, I'm excited about prevention. In my practice, we teach about preventing, but prevention does not make them money. Sadly enough, illness does. So, I mean, in insurance where I don't have an insurance practice, I have a cash practice. And I left because I couldn't get my people who needed a lab test to see if they were diabetic or not. The insurance would cover it. I'm like, we should be able to get that every single year. It's a $5-6 test if we rent it for cash, but it's $300 when we go through insurance. I mean, wow. the system is all mixed up and messed up. But like I said, that's not where the money is. The sicker we are, the more that they can capitalize off of that. That means the more people in and out of hospitals. That means those people make more money. So all of these people stand to benefit in several different ways. But I say prevention is the key. Find you a doctor that looks like you, that listens to you, that loves you, and will tell you right, and fuss at you and whoop you on Wednesdays if you don't do right. So find somebody you have a good relationship with, and they can talk to you about prevention. Because if you don't know better, you can't do better. So go learn to know better so you can do better.
Dr. Lyman, I got another little quick one.
Go ahead, brother.
Obesity. Guess what? The thing of obesity. Guess what that leads to? Diabetes, hypertension, and a boatload of other things that are preventative, like Dr. Johnson just said. So if you attack obesity, meaning if you get your rump up and move a couple times every hour, you try to eat better, you don't have to start all the way over. A lot of people, like I said, we live in a microwave society. So what people say, all right, today is the last day. I ain't eating unhealthy no more. They go in there and clean out all the food in their whole house. Then they ain't got nothing to eat. So what they doing in 2 more days? They right back on the wagon. They didn't broke down. I can't take it. So they're going right back into it. And so I encourage and challenge people to do one thing at a time. If sodas is one of your weaknesses, say, hey, I'm gonna cut back on sodas. Don't say I'm gonna cut soda out indefinitely altogether. Say I'm gonna drink one less soda than I did today, and you build on that.
Right. So why has the government invested so little in food subsidies?
I think that it may have to do with leadership and the focus of our leadership. So it changes as leadership changes. So I think that right now everything is disease. They look at disease, they're looking at vaccine, they're looking at prevention, and that's so far down the line it's not important. It's just so far down the line, and I'm hoping that as we get grasp on some of these things up front, the illness, COVID, and all of that kind of stuff, vaccines and all of that, that it moves up toward the front of the line. But sadly, once it's out of the way, they're on to the next so easily. So I think that it's the leadership's focus.
All right. So how are SNAP and WIC programs beneficial to Black families who live in food deserts?
Go ahead,
I think
Gina.
they're abundantly beneficial because the biggest thing that our community suffers from is access. We don't have access, and so SNAP and WIC brings you access. If you can't go out and if you got $10 in your gas tank and it takes $10 to get to the grocery store, that means you don't have no money to spend at the grocery store. So that means you're gonna need some type of assistance to help you out with that. And guess what? That $10 now, if you have some type of financial education behind that, now you're gonna save that $10 that you budgeted for that gas and go to the grocery store. You roll that over to the next month. Now you got $20 to spend at the grocery store, and you're utilizing WIC and other subsidies that are helping the families that are put there, and you're removing your pride. And it's so hard. Oh, we such a prideful people, and I love my people. I mean, we're prideful Black people. I'm a prideful person. I'm prideful myself. You know what I'm saying? And you know what the Bible says about pride and all those things. It's good to be confident, but prideful, you know what I'm saying? It's kind of, it's not it's frowned upon to be overly prideful. But if you need help, you got to open your mouth and you got to be able to receive that help. And in order to receive that help, you got to be educated enough to know how to apply that help.
All right. Well, how about at this time we do closing remarks from both Gino, Dr. Johnson.
Dr. Johnson.
All right, thank you. Thank you. Thank you for having me. I have enjoyed this tag team with you, Gino. We need to take this show on the road and get people the help that they need. I'm Dr. Cree Johnson. I'm a board certified family medicine physician in Trussell, and I am just so happy to serve in educating our people, because I feel like when we know better, you can do better. And that's my mission, to helping to educate us in the realm of health. So thank you guys for having me, and I look forward to serving whenever you guys need me.
All right. Thank you. Thank you, Dr. Johnson.
Thank you, Dr. Johnson. I just like to say thank you to Birmingham Civil Rights Institute, Ms. Moya, Dr. Lonnie for being an awesome host and moderator of this talk. My awesome colleague. We definitely got to work some more, Doc. We got to do it's a lot of work for us out there to be done. But I like to try to always leave conversations like this with a thoughtful, thought-provoking kind of analogy or something that can help you. Earlier, I gave you the 5 Ps, which is prior planning prevents poor performance. That can be applied to everything in life. I want to leave you with this one. It takes more effort to be efficient, and efficient is effective. Once you become effective, you increase your efficacy. I'm gonna give it to you one more time. It takes more effort to be efficient. Once you are efficient, you become effective. Once you are effective, you increase your efficacy rate. All right, so I challenge everybody to do. Faith without works is dead. All right, we can't just sit behind our computers, screens, and hope and wish and pray that something's just going to drop out of the sky and help us. We have to take charge of our lives, our communities, our health. And we have to go out and we have to lean in and we have to put the pressure on the people that we put in office that represent us to make sure that they are representing us holistically. And when we say holistically, we talk about the ecosystem: mental, physical, emotional, social, and financial. If we're not represented in all those things which make up wellness, that's how I have my wellness program made up. I am in charge of the 3,700 employees, mental, physical, emotional, social, and financial wellness here at the city of Birmingham, which, as you see, I take that very serious. So if we can continue to spread the word on being efficient, and efficient is effective, if we can continue to spread the word of faith without works is dead, getting out there, getting your hands dirty, don't be what they call Twitter fingers or internet thug. You got to get out there and get your hands dirty and do the works, and also getting out and going to getting out and going to these to our neighborhood meetings and our city council meetings and different things, and putting the pressure and saying, hey, we have a serious problem going on, and we don't see a way out of the tunnel until we need some light shed on this area, and we got to have it. So I appreciate each and every one of you for tuning in, and Dr. Lonnie, you man.
All right. Well, I want to definitely thank Gina Malisham for putting this together. I also want to thank Moya Morgan for working with us to put this program on today. And I pray that the information provided to the residents and to all of the people in our viewing area will be helpful and be empowering to them, right? And we did tackle some really sticky issues that require a lot of thought, but at the end of the day, we have to take the thought that we put into this, and we have to put it into effect. And so, like Gino said just a second ago, faith without works, faith without action is dead, right? And so I encourage everyone to be thoughtful about this, but I also encourage everyone to get involved in the civic engagement required to bring about change in our areas, the civic engagement required to empower us collectively and as individuals. All right, so I want to thank everyone for their time today.